Have you ever woken up to find your ankles swollen or noticed your fingers feeling tight in your rings? This unexpected swelling, known as edema, can be a sign of an underlying health condition. Edema occurs when excess fluid gets trapped in your body's tissues, causing them to swell. It's like a sponge holding onto too much water. While it might seem harmless at first, edema should never be ignored. It can be a signal from your body that something isn't quite right. Understanding the causes of edema is crucial for effective management and prevention. Edema is a medical term for swelling caused by fluid buildup in the body's tissues. This fluid, primarily water, leaks from your blood vessels into the surrounding tissues, leading to puffiness and discomfort. Think of your circulatory system as a network of pipes carrying blood throughout your body. When these pipes become leaky, fluid escapes into the surrounding tissues, causing them to swell. Edema can affect any part of your body, but it's most common in the feet, ankles, legs, hands, and face. It's important to note that edema itself is not a disease, but rather a symptom of an underlying condition. Recognizing edema is crucial for early detection and treatment. Edema or swelling can be a sign of various underlying health conditions, ranging from mild to severe. It's important to understand the different ways edema can manifest in the body. While the most obvious sign is swelling, it can occur in different parts of the body, such as the ankles, hands, and feet. This swelling is often due to an accumulation of fluid in the tissues. There are other subtle cues your body might be giving you. For instance, you might notice that your jewelry or clothing feels tighter than usual, or that you have gained weight unexpectedly. Swelling in the affected area is often noticeable and can make the skin appear stretched and shiny. The shiny appearance is due to the skin being stretched tightly over the swollen area. You might find it difficult to move the affected area due to the increased fluid pressure. This can lead to a reduction in your range of motion and make everyday activities more challenging. Pressing on the swollen area can leave a small indentation, known as pitting edema. This is a common sign of fluid retention and can be a useful diagnostic tool for healthcare professionals. This indentation slowly disappears as the fluid returns to the tissues. The speed at which the indentation disappears can provide clues about the severity and type of edema. Other signs of edema include discomfort, stiffness, and a feeling of tightness in the affected area. These symptoms can vary in intensity and may worsen over time if left untreated. If you notice any of these signs, it's essential to consult your doctor. Early diagnosis and treatment can help manage the symptoms and address any underlying health issues that may be causing the edema. Your circulatory system, comprising your heart, blood vessels, and blood, plays a vital role in maintaining fluid balance. This intricate network ensures that nutrients and oxygen are delivered to your cells while waste products are removed. The heart acts as a pump, pushing blood through a vast network of arteries, veins, and capillaries. These vessels are not just conduits for blood, they also help regulate the distribution of fluids throughout your body. When this system is compromised, it can lead to edema. Edema is the medical term for swelling caused by excess fluid trapped in your body's tissues. It can affect any part of your body, but is most commonly noticed in the legs, ankles, and feet. The underlying causes of edema can vary, but they often involve issues with the circulatory system. One of the most common circulatory issues leading to edema is venous insufficiency. This condition is characterized by the veins' inability to efficiently return blood to the heart. Venous insufficiency can result from prolonged standing or sitting, obesity, pregnancy, or aging. It can also be a consequence of deep vein thrombosis, where blood clots form in the deep veins of the legs. This condition occurs when the valves in your veins, which help blood flow back to the heart, become weak or damaged. These valves are crucial for preventing the backflow of blood. When they fail to function properly, blood can pool in the lower extremities, leading to increased pressure in the veins. This pressure forces fluid out of the blood vessels and into the surrounding tissues, causing swelling. As a result, blood pools in your lower legs and feet, increasing pressure in the blood vessels and causing fluid to leak into the surrounding tissues. This leakage results in the characteristic swelling of edema. Symptoms can include a feeling of heaviness, aching, and even skin changes such as discoloration or ulcers. Managing venous insufficiency often involves lifestyle changes, compression stockings, and in some cases medical procedures to improve blood flow. Other circulatory problems, such as heart failure, can also contribute to edema. Heart failure occurs when the heart is unable to pump blood effectively, leading to a buildup of fluid in various parts of the body. This can be due to conditions like coronary artery disease, high blood pressure, or previous heart attacks that have weakened the heart muscle. When your heart weakens, it can't pump blood efficiently, leading to fluid buildup in the lungs, legs, and other parts of the body. This fluid buildup, known as congestive heart failure, can cause significant discomfort and health issues. Symptoms may include shortness of breath, fatigue, and swelling in the lower extremities. Treatment for heart failure often involves medications, lifestyle changes, and sometimes surgical interventions to improve heart function and reduce fluid accumulation. Section 5. Kidney function and fluid balance. Your kidneys are essential for filtering waste products and excess fluid from your blood. When your kidneys are not functioning correctly, fluid can build up in your body, leading to edema. Think of your kidneys as your body's filtration system, constantly cleaning your blood and maintaining fluid balance. When this system is disrupted, it can lead to a buildup of toxins and excess fluid. Kidney diseases such as glomerulonephritis and nephrotic syndrome can damage the delicate filtering units of the kidneys, impairing their ability to remove waste and excess fluid. This impairment can lead to edema, particularly in the legs, ankles, and around the eyes. Section 6. Hormonal imbalances and edema. Hormones play a crucial role in regulating fluid balance in your body. They act as messengers, coordinating various functions and ensuring that your body maintains homeostasis. This delicate balance is essential for your overall health and well-being. When hormonal imbalances occur, it can disrupt this balance, leading to edema. Edema is the medical term for swelling caused by excess fluid trapped in your body's tissues. It can affect any part of your body, but is most commonly noticed in the hands, arms, feet, ankles, and legs. One such hormone is aldosterone, which helps your body retain salt and water. Aldosterone is produced by the adrenal glands and plays a key role in regulating blood pressure and maintaining the balance of fluids and electrolytes in your body. When aldosterone levels are high, your body holds onto excess sodium and water, leading to fluid retention and edema. This can result in noticeable swelling, particularly in the lower extremities, and can be uncomfortable and sometimes painful. Premenstrual syndrome, or PMS, is a common example of hormone-related edema. Many women experience symptoms such as bloating, breast tenderness, and swelling in the days leading up to their menstrual period. Fluctuations in estrogen and progesterone levels during the menstrual cycle can cause fluid retention, leading to bloating, breast tenderness, and swelling in the hands and feet. These symptoms can vary in severity from one cycle to the next. Other hormonal conditions, such as thyroid disorders and Cushing's syndrome, can also contribute to edema. Thyroid hormones regulate metabolism, and imbalances can lead to fluid retention. Cushing's syndrome, caused by high levels of cortisol, can also result in significant swelling and other health issues. Section 7. Lifestyle factors and their impact. While underlying medical conditions are often the culprits behind edema, certain lifestyle factors can also play a role. Consuming a diet high in sodium can lead to fluid retention. Sodium attracts water, so when you eat salty foods, your body holds onto more water, leading to swelling. Leading a sedentary lifestyle can also contribute to edema, especially in the legs and feet. When you sit or stand for long periods, it hinders proper blood circulation, making it easier for fluid to pool in your lower extremities. Certain medications, such as corticosteroids and some blood pressure medications, can also cause fluid retention as a side effect. Section 8. Addressing the root cause. Treating edema effectively requires identifying and addressing the underlying cause. Once the root cause is addressed, the edema often resolves on its own. If your doctor suspects an underlying medical condition, they may recommend further tests such as blood tests, urine tests, or imaging scans to confirm the diagnosis. Treatment for edema varies depending on the cause. For instance, treating venous insufficiency might involve wearing compression stockings, while managing kidney disease might require medications and lifestyle changes. In some cases, lifestyle modifications, such as reducing sodium intake, elevating your legs, and staying active, can be helpful in managing edema. Section 9. Conclusion. Taking charge of your health. Edema, while seemingly simple, can be a complex condition with various underlying causes. Understanding the factors that contribute to edema is crucial for effective management and prevention. If you experience persistent or unexplained swelling, it's essential to consult your doctor to rule out any underlying medical conditions. By addressing the root cause and making necessary lifestyle changes, you can effectively manage edema and prevent it from recurring. Remember, your health is in your hands, and taking proactive steps towards understanding and managing edema is crucial for your overall well-being.